Welcome to the deep dive. Today we're really getting into the weeds on nutrition for older adults. We're summarizing a key chapter called Nutrition in Older Adults, Conditions and Interventions.
Right. And the goal here isn't just about living longer, lifespan. It's about health span, those years lived well without serious illness.
Exactly, and the sources make it super clear. The 65-plus group is incredibly diverse, highly heterogeneous.
Totally. You can't paint everyone with the same brush.
Right, and it's funny, something like 78% of older adults say their health is good or excellent.
Which is great. But,
But yeah, underneath that, chronic conditions are really common.
oh, absolutely. Especially hypertension. We're talking like 86% of women over 75 and about two-thirds of men aged 65, 74. It's massive.
Wow.
So that's where medical nutrition therapy, MNT, comes in. It's not just nice to have. It's a really powerful tool to maintain quality of life.
Okay, so let's unpack that, starting with the big ones, the leading causes of death, heart disease and stroke.
Yeah, and what's really interesting here, it kind of flies in the face of what we usually think.
Oh.
Well, for folks over 65, those classic risk factors like high LDL cholesterol or just general obesity, they're actually less predictive of heart attacks or strokes compared to younger people.
Really? So what is more important then? The focus shifts.
Exactly. The focus shifts. Things like kidney function, maybe undiagnosed diabetes, general inflammation. Those markers seem to tell us more in this age group.
Huh. But the basic advice on diet stays similar.
Pretty much, yeah. Lots of fruits, vegetables, nuts, whole grains, cut back on processed meats, refined carbs, and that Mediterranean-style diet keeps popping up as protective.
Okay. Now, what about stroke? That's about blood flow to the brain, right?
Right. Two main types. Ischemic, where a vessel gets clogged, and hemorrhagic, where one bursts, like an aneurysm.
And the aftermath can be really tough for survivors.
Yeah, it's sobering. The stats show, even 6 months later, about 35% deal with depression. 30% need help walking. And almost 20% have aphasia. They struggle with speech.
Wow. So prevention is absolutely key here.
Totally. It's mostly about diet, getting those fruits and veggies in, and keeping blood pressure under control.
Which brings us neatly to hypertension. You said it's the most common one.
By far. And the target for folks 65 and over is pretty tight, under 130 systolic and under 80 diastolic.
So how do we get there nutritionally?
Well, the big player is the DISH diet, dietary approaches to stop hypertension.
Ah, yes, DASH. What makes it so effective?
It's quite specific. It tells you exactly how many servings of things like vegetables, fruits, whole grains, low-fat dairy to aim for each day. And crucially, it emphasizes low sodium.
Okay, low sodium. How low are we talking?
The target is usually around 1,500 to 1,800 milligrams a day. And studies show that combining DASH with that level of sodium restriction really works to lower blood pressure, often without needing drugs.
1,500 milligrams.
Yeah.
That sounds tough. Where does all the sodium come from?
Yeah, it's tricky because about 75% of it, it's not the salt shaker. It's already in the food from processing and preservation.
So you really have to watch packaged and restaurant foods.
Absolutely. You pretty much have to lean towards whole, unprocessed foods to hit those DAS church targets.
Okay, so we've talked cardiovascular. Let's shift gears to metabolic health, specifically diabetes. Huge prevalence there too, right?
Massive. About 29% of adults over 65 have diabetes.
And managing it in older adults has some unique challenges.
It does, because diabetes seriously ups the risk for things like amputations, vision loss, nerve damage.
Neuropathies, right?
Exactly. And all of that contributes to a much higher risk of falls. One study found something like 22 to 31% of older adults with diabetes had a fall within a year.
Yikes. So I know the blood sugar targets, the HbA1c, are sometimes a bit looser for older folks. Why is that?
It's all about balancing risk. For a relatively healthy older adult, you might aim for under 7.0 or 7.5%. But if someone has a lot of other complications or cognitive issues, the goal might be relaxed to under 8.0%.
Why relax?
To avoid hypoglycemia, blood sugar dropping too low, that's really dangerous in older adults. It can cause confusion, weakness, and lead straight to one of those devastating falls.
Got it. Safety first. So the nutritional focus isn't necessarily aggressive weight loss or super strict carb counting.
Not always, no. It's more about consistency. Eating nutrient-dense carbs like non-starchy veggies and whole grains at regular times. And getting enough fatty fish is important too for heart health and inflammation.
Okay, this connects nicely to the whole issue of weight and body composition.
Right.
Let's talk about BMI and why it gets complicated in older adults. The sarcopenia-obesity paradox.
Right. So BMI usually goes up until around age 60, and then it tends to drift downwards after 70.
Right.
But that drop in BMI can hide a dangerous trade-off. You might be losing muscle mass, that's sarcopenia, while actually gaining fat, especially around the middle.
So the number looks better, but the composition is worse.
Exactly. And here's the paradox. Studies actually suggest that the BMI range linked to the lowest death rate in older adults is technically in the overweight category, like 24 to 30.9.
Whoa. So being a little heavier might be protective. That's counterintuitive.
It seems so, statistically. Which tells us BMI alone isn't a great measure here.
So what should we look at instead?
Things like waist circumference or waist-to-hip ratio, measures of abdominal fat, those are actually better predictors of early death than just BMI.
And this leads to sarcopenic obesity.
Yep, low muscle, high fat. And it's a tricky situation because the instinct might be, okay, let's lose weight.
Right, but that's risky.
Very risky, because when older adults, especially those with sarcopenia, lose weight intentionally, they tend to lose a higher proportion of precious muscle mass. And if they regain weight later, it's mostly fat. So they end up worse off functionally.
So aggressive dieting is out. What's the approach?
Focus on maintaining weight or very gradual loss if truly needed, combined with exercise, both aerobic and, crucially, resistance exercise. Lifting weights, using bands. That's the only way to really fight muscle loss.
Build and keep that muscle.
Okay.
But strong muscles need a strong frame. Let's talk bones osteoporosis.
Right, porous bone. Huge issue. We're talking 1 in 2 women and maybe 1 in 4 or 5 men over 50 will have a fracture related to it.
Wow, and it's about bone built up earlier in life, plus loss later on.
Pretty much. Didn't build enough peak bone mass when young, combined with faster loss later, especially after menopause for women, or with certain hormonal changes in men.
So, nutritionally, what's the plan?
The big targets are 1,200 milligrams of calcium a day and 600 to 800 IU of vitamin D.
Standard advice. Anything else? The sources mentioned protein.
Yeah, the protein piece is interesting. There used to be some concern about too much protein leaching calcium. But the newer thinking, according to these sources, is that not enough protein might actually be the bigger problem for bones, assuming calcium intake is okay. Protein forms the matrix, the scaffolding for the minerals.
So you need the building blocks and the cement. Makes sense.
Exactly. Other helpful things. Plenty of fruits and veggies. They have an alkalinizing effect that helps bones. Taking calcium supplements in smaller doses throughout the day. And maybe watching high sodium and caffeine if calcium intake is low.
Okay. Moving down the body. Oral health. If you can't chew well, you can't eat well.
So true. 2 common things are xerostomia, dry mouth, and periodontal disease.
The dry mouth, often medication related.
Very often. Diuretics, antidepressants, lots of common meds can cause it. Makes things taste weird, hard to swallow. Simple fixes can help, like sugar-free candy or gum with xylitol or just sipping water often.
And periodontal disease, gum disease. That's linked to other stuff too.
Definitely. It's tied to heart disease, and there's a strong link with diabetes. Basically, high blood sugar makes your saliva sugary too, which feeds the bacteria that cause gum disease. It's a vicious cycle.
Okay. Let's hit the GI tract. G or D, constipation, and something really important about B12.
Right. GRD acid reflux. Main advice is smaller, lower-fat meals, stay upright after eating, limit triggers like alcohol, caffeine, spicy food.
Standard stuff. What about constipation? Super common concern.
Very common, often defined by things like straining, hard stools going less than 3 times a week. But sometimes older adults worry just because they aren't regular every single day.
Right, misconceptions. What actually helps?
It's a trio. Fiber, fluid, and muscle tone. You need all 3. Just adding fiber without enough water can backfire.
Good point. Any alternatives to laxatives?
Yeah, the sources mention something called power pudding, basically a mix of applesauce, bran, and prune juice. Sounds potent, but effective, especially in care homes.
Okay, now the B12 issue. You said this was critical.
Absolutely critical. B12 deficiency is surprisingly common. Maybe 3 to 26% of older adults, even if they eat enough B12-rich foods like meat or dairy.
Why? What's going wrong?
It's often about stomach acid. As we age, or if we take a lot of antacids or PPIs...
Proton pump inhibitors, yeah.
Right. Stomach acid levels decrease. And you need that acid to do something specific.
Which is?
B12 in food is bound to protein. Stomach acid's job is to snip the B12 off that protein so it can be absorbed later on. No acid or low acid. The B12 stays stuck, passes right through you.
Wow. So you could be eating plenty, but absorbing none of it.
Exactly. And B12 deficiency causes nerve damage, sometimes irreversible.
That's scary. So what's the recommendation for everyone over 50?
Get B12 from fortified foods or supplements. The B12 in those forms, crystalline or synthetic, is not protein-bound. It doesn't need the stomach acid step for absorption. It's a simple workaround to prevent a serious problem.
Okay, that's a huge takeaway. B12 supplements or fortified foods after 50. Got it. Let's talk cognition. Alzheimer's, dementia.
Yeah, Alzheimer's is the big one, 60–80% of dementia cases. There's been a lot of focus on B vitamins like B12 and folate and homocysteine.
Right. High homocysteine is linked to cognitive decline, and B vitamins help break it down. So supplements help?
Well, that's the hope, but the evidence isn't there yet. The sources are clear. B vitamin supplements have not been shown to slow down Alzheimer's progression once it's started.
So, like with the heart disease risk factors, the biology makes sense, but the intervention doesn't quite work as expected. What about diet for prevention?
Again, the Mediterranean diet shows up. Better adherence seems linked to lower risk of cognitive decline and AD.
And when someone has cognitive impairment, the focus shifts to practical stuff.
Exactly. Making sure food is nutrient-dense, keeping them hydrated, making meal times calm, maybe using finger foods if coordination is an issue, just making eating easier and safer.
Makes sense. We also have to touch on polypharmacy, taking lots of meds.
Huge issue. Over 40% of folks over 65 take 5 or more prescription drugs.
5 or more.
Yeah. And every single one carries potential nutritional interactions or side effects. Think about warfarin and needing stable vitamin K, or meds that kill appetite, change taste or smell.
Or even indirect effects.
Yeah.
The sources had a case study.
Yeah, a really striking one. Someone got prescribed bitter eye drops. They started drinking tons of extra water to wash the taste away. That led to nocturia, getting up multiple times at night to pee. And on one of those nighttime trips, they fell and broke a bone.
Wow. Just from eye drops. It shows how interconnected everything is.
Totally. And speaking of risk, we need to talk about being underweight.
Right. Unintentional weight loss is a big red flag.
Massive red flag. Losing 5% of body weight in a month or 10% in 6 months, that's a serious sign of malnutrition and is strongly linked to higher mortality. It's actually much riskier than being slightly overweight at this age.
So if that happens, intervention needs to be quick.
Yes. Needs more calories, around 30–35 kilocalories per kilogram, and definitely more protein, 1.0 to 1.5 grams per kilogram, to try and rebuild that lost tissue. But start slow.
Okay. And lastly, hydration. Always important, but especially tricky for older adults.
Very tricky. Their thirst signal isn't as strong. Kidneys might not conserve water as well. Mobility issues can make getting drinks harder.
So they can get dehydrated easily without realizing it. How can you tell? Thirst isn't reliable.
Right. Look for other signs. Upper body muscle weakness, maybe difficulty speaking clearly, confusion is a big one, and even dry, furrowed tongue. Look for lines running down the length of the tongue.
Interesting. What's the fluid target?
General rule is about 1 milliliter of fluid for every calorie eaten. Minimum of 1,500 milliliter, which is about 6 8-ounce glasses per day, and rehydrate slowly if they're behind. And just quickly, we should mention bereavement.
Ah, yes. Social factors are huge.
Losing a spouse or loved one, grief can just take over. Normal routines like cooking and eating fall by the wayside, making someone really vulnerable to malnutrition.
So social support, shared meals, anything to keep that connection to food and routine is vital then.
Absolutely. So if we boil all this down, what are the absolute must-knows?
Good question. What are your top 3?
Okay. 1, BMI alone is not enough. Look at waist circumference, watch for muscle loss, sarcopenia. Being slightly overweight might even be okay.
Got it. 2,
B12 malabsorption is real, it's silent, and the nerve damage can be permanent. Anyone over 51 needs B12 from fortified foods or supplements, period. Don't rely on just diet.
Okay, critical. And 3.
3, keep an eye on the system-wide stuff. Hydration is key, and polypharmacy, all those meds can cause unexpected problems, like that eye drop story. You have to connect the dots.
Absolutely. Which leaves us with a thought for you, the listener. We've talked about all these different dietary needs: low salt, steady carbs, high fiber, enough protein-specific vitamins. How do we put that all together?
Yeah.
How can medical nutrition therapy help someone manage multiple conditions without making food feel like a burden, like just a list of restrictions?
Yeah, how do we empower people to use nutrition to live well, not just follow rules? That's the real challenge and maybe the art of MNT in aging.
Definitely something to think about.
Well, thanks for diving deep with us today on this really important topic.
Yes. Thank you for listening. We'll catch you on the next deep dive.